Today we are going to talk about arthritis of knee joint. I am Dr. Rahul Grover and I am an orthopedic surgeon at Meteor Hospital, Kutub Institutional Area. This is a normal knee joint. It has got smooth cartilage over which all your knee joint movements happen, and as you age, the cartilage surface of this joint gets wear off, and when it starts to wear off, this is called as osteoarthritis of knee joint. That happens with age. So the first stage of arthritis is mild arthritis or grade 1 arthritis, in which there is loss of cartilage at the places and the patient has mild to moderate pain and has got walking distance reduced as compared to normal. This then advances. One thing about osteoarthritis is that the progression happens over the years and it continuously progresses. We cannot reverse arthritis. Arthritis cannot be stopped, but it can be reduced as far as its progression is concerned. So when the patient enters into advanced arthritis, that is grade 4 arthritis, then the joint looks like this. The whole cartilage layer is gone and the patient has extreme pain and the patient is not able to walk even 1 kilometer. So in that case, we have some treatment options that varies according to the stage of arthritis. When patient comes in mild arthritis or grade 1, grade 2 arthritis, we can offer them viscosupplementation, that is in which we give them hyaluronic acid injections right inside the knee joint, which causes lubrication of the joint surface, and this lubrication leads to reduction in pain. The effects of viscosupplementation are variable. It can last from maybe 3 months to even 3 years. Then in next stage, that is grade 3 osteoarthritis, in that case what we have to offer is that we can offer them radiofrequency ablation. That is a type of pain management technique that we are doing these days, and this is even possible at Meteor Hospital, Kutub Institutional Area. We are doing radiofrequency ablation of the nerve supplying knee joint, that is the genicular nerve. We just ablate it, or we can say हम उसे जला देते हैं उस particular nerve को, and the effect of this intervention, that is radiofrequency ablation, basically lasts for around 2 to 3 years. The patient will be completely pain free for next 3 years if you use radiofrequency ablation. And by the time you make up your mind for getting a knee replacement done, then you can straight away go for the knee replacement. So first of all, there is a myth among the masses that in knee replacement we completely replace the knee joint. But no, it is actually not the knee replacement. It is basically resurfacing of the joint. What we do in total knee replacement is that we remove some part of your degenerated cartilage and we take off the bone of this, that is diseased bone of the joint. We remove the diseased bone, and then after removing the diseased bone, we get something like this. And then we place our implant over it, that is simply known as हमने इसकी cap change कर दी. तो knee replacement से ज़्यादा अच्छा terminology is the cap change करना, because here we are not replacing your knee joint, we are just changing the surface of your knee joint. Similarly, we do this on the lower end of your knee joint, that is on the tibial surface. We apply this tibial component over it, and then these two surfaces, you will be using these two surfaces, you will be able to move your knee joint painlessly, and you can even walk 10 kilometers a day without any pain. You can even jog, you can even run, you can play golf. Whatever you can do it. Now the next question arises in the mind of my patient is that, sir, what is the lifespan of this implant? So the lifespan of this implant usually varies from 20 to 25 years in Western population, but usually they have got very high activity even after total knee replacement. But as far as Indian population is concerned, they are not so active after getting knee replacement done. So I have seen my patients having total that is the lifespan of this implant is around 30 to 35 years. Next question that arises in the mind of my patient is that how long is going to be the incision? So as far as I'm doing the surgery, my incision usually just 4 finger breadths long, that is around 6 to 7 centimeters and not more than that. We also do robotic knee replacement. So what is the difference between robotic knee replacement and conventional knee replacement? In robotic knee replacement, we have got a higher precision levels. Here, the robot predicts the amount of cut that needed to be made in order to place the implant components. So that reduces the complication rate, that increases the success of your surgery. And yes, conventionally there was more than 95% success rate, but now with robotic surgery we have almost 99.99% success rate. So that was about the knee replacement. And as I've already discussed, there are other methods and means by which we can slow the progression of knee arthritis. So yes, knee replacement is not for those who are into grade 1, grade 2 or maybe grade 3 arthritis. This is for the severe form of the arthritis, that is the last stage, that is grade 4. And we have all the spectra of interventions available, that is from viscosupplementation to physiotherapy to radiofrequency ablation to total knee replacement. And even if the patient is young and unfortunately he or she gets arthritis of knee joint, that too which involves only inner compartment of your knee joint, then we have a facility of doing partial knee replacement, that is also called as unicondylar knee replacement, UKR. So that can be done if the patient is young, if the patient has got less weight, that is not obese, then getting a UKR done is very successful option rather than a TKR done. So that was it about the total knee replacement and knee diseases. Thank you so much.